We continue with the large intestine channel, the primary channel. The large intestine channel starts from the tip of the index finger. It then runs along the radial side of the index finger and up the lateral anterior aspect of the arm. It then reaches the shoulder at the point Li15. From here, it connects with Du14 and descends to the supraclavicular fossa to enter the lung. From the supraclavicular fossa, it ascends along the sternocleidomastoid muscle to the cheek and enters the gums of the lower teeth. It then curves around the philtrum and crosses over to end at the side of the nose where it links with the stomach channel. Overview of the large intestine points. It affects the arm, shoulder, neck, and head. Expel exterior wind, treat the face and sinuses. Many points dissipate nodules and treat goiter. The large intestine primary channel pathway, the external part of the large intestine primary channel begins on the index finger, Li1, at the radial aspect of the corner of the nail. This point is reached by a branch which separates from the lung primary channel at lung 7, Han-Yang main connection of the first grade circuit. The large intestine primary channel runs between the first and second metacarpal bones, then runs proximally along the radial aspect of the forearm towards the lateral aspect of the elbow. Travels in a proximal direction along the lateral aspect of the upper arm towards the shoulder. Crosses the small intestine primary channel at SA12 in the center of the suprascapular fossa. Continues to Du14 inferior to the spinous process of the 7th cervical vertebra where it meets with the other 5 young primary channels. Crosses the neck and enters the supraclavicular fossa at stomach 12. Here, the internal pathway branches off and connects with the lung. It's paired some organ, penetrates the diaphragm and enters the large intestine. It's pertaining to organ. From the large intestine, according to some authors, the large intestine primary channel, an internal branch, runs in an inferior direction to stomach 37 on the lateral aspect of the lower leg, the lower hesi point of the large intestine. The external branch ascends from the supraclavicular fossa, travels along the lateral aspect of the neck, and traverses the cheek. From here, another internal branch enters the lower gums where it extends farther. The external force of the primary channel passes stomach 4 and curves around the mouth to the upper lip, crossing to the contralateral side of the body at Du26, located at the philtrum. On the contralateral side of the body, it reaches Li19 and terminates contralaterally at Li20 on the side of the nose. Note, Deadman et al. 1998 mentioned REN 24 as additional meeting point variant figure. They also mentioned GB5, GB6, GB14 as a classic meeting points for the large intestine channel, but these are not normally shown in illustrations of the channels. Clinical importance, exterior signs and symptoms, fever, dryness of the mouth, thirst, a sore and swollen throat, nosebleed, toothache, red, painful eyes, stiff fingers, painful cold, or painful hot swelling of the upper arm and shoulder. Interior or punctal organ signs and symptoms, pain in the lower abdomen, vertiginous, diarrhea or yellow stools with mucus, shortness of breath, dyspnea. Excess, heat sensation along the channel, deficiency, cold sensation, and chills along the channel. Connections of the large intestine primary channel with other channels. Lung primary channel, connection, Han-Yang connection of the first great circuit. Location, lung 7, Li1 on the hand. A branch of the lung primary channel connects with the large intestine primary channel at LI1. Circulation, circadian, according to the organ clock. Importance, exterior-interior relationship. Stomach primary channel connection paired according to the 6-channel theory. Hand-foot pairing, yang axis of the first great circuit. Location, LI20, bladder 1, stomach 1 on the head. Circulation, circadian, according to the organ clock. Importance, above-below relationship. With the Sangpo organ system, lung, large intestine, stomach. Here, the illustration, it passes through SI12 to 14, connects with the lung and descends the large intestine. So this is the large intestine primary channel, connects with the large intestine and lung.